So can you take fat from any area of your body? Is there specific areas where you feel like the fat stays better?
I mean, I think again, generally harking back to breast reconstruction, lower abdomen, inner thighs were like popular areas to take fat from. And I felt like the take was pretty good. But again, I will go, some people are like, don't touch my thighs or don't touch my abdomen, or they're already, they have, for the thinner patients, I usually find that the lower back and flanks has a little bit of fat I can use that even in the skinniest patients can cough up some fat. But I've used arms, I've used calves successfully. I got a lot more fat out of this one patient's calves than I imagined I would, because I had already said, okay, well, we'll do your calves, but I'm going to have to take some fat from your thighs because there's no way we're going to get enough to do your breasts. But she did great. We didn't really need to take that much from her thighs at all because I shockingly got a lot out of her calves. It's
Would
another
you
area that you can, liposuction if that's your concern.
I would love for you to lipo my calves. Would you say there's a minimum BMI or a maximum for patients that you would be like, or is it based off just what you see?
It's a little bit off what I would see. I mean, I feel like anywhere, BMI in the 20s. It just depends. I mean, people definitely can be skinny fat. Like it just depends what your muscle, yeah, maybe your BMI is low, but you're not really muscular. So you have a little fat to donate. Just depends on the patient. And then, I mean, a safe cutoff is usually a BMI of 35 for just surgery in general. And then the limitation, I think we've talked about this before, for liposuction on one person at one time is 5 liters. So if your BMI is creeping up beyond 35, like we need to see, then I do say, yeah, we can do that, but we're going to hit the 5 liter mark. So pick, the areas of priority that you want to address, because otherwise I'm just taking a little from everywhere and you aren't going to be satisfied.